I'm Breck, your Senior Information Specialist, bringing you another 2-minute tip. Today's topic is how to get home care for your loved one. In the last video, we identified some ways to tell that your loved one could use a little extra help staying safe at home. So in this video, I'm going to talk to you about how to get the most appropriate care for their needs. When it comes to private duty home care, there are 3 types of agencies you can choose from. The first is called a companion agency. They provide care for people who don't need any hands-on care. So if your loved one just needs help with things like transportation and meal preparation and someone to keep them company throughout the day, this is a good option for you. However, if your loved one needs hands-on care, so help with things like bathing and dressing, you have 2 options. The first is called a nurse registry. Now, nurse registries can provide all of the same services as the companion agencies, but they can also provide hands-on care. And the reason for this is that they use certified nursing assistants and home health aides to go into the home and provide the care, so licensed professionals. What you need to know about a nurse registry is that their caregivers, so the certified nursing assistants and home health aides, are subcontractors. So this means that the nurse registry is not required to carry workers' comp or liability insurance on the caregivers. So basically what this means for you is that if the caregiver has an accident in the home, your loved one's homeowner's insurance would be responsible for this, and the nurse registry itself would not have any responsibility in these kind of matters. And then the second option, if your loved one needs hands-on care, is to use a fully licensed home health agency. Now, these are very similar to a nurse registry. They also use certified nursing assistants and home health aides to provide the care, but the difference is that fully licensed agencies employ all of these caregivers, so they do carry that workers' comp and liability insurance on them. So that means, they will be liable in the event of, an accident in the home, and your loved one would not be responsible. An easy way to tell if you are working with a nurse registry or a fully licensed agency is to ask them for their license number. Nurse registry license numbers begin with NR, and a fully licensed home health agency license number begins with HHA. So this is your 2-minute tip for today, brought to you by Bayshore Home Care.